So I'd like to move to our first panel, which is the SNF Global Health Initiative, with the core being the hospitals. So this is an initiative that we started almost 10 years ago, and it's going to be, the core will be completed with the delivery of the new hospitals in Komotini, in Sparta, and in Thessaloniki next year, 2027. So it's going to basically have taken a decade since we started. We're very proud of it. We started, as usually we do, with something small, an idea, which develops and evolves because of all our partnerships and because of the ideas that we exchange with our partners. So we started with just basically renovating a nursing facility, I mean the nursing school, which, by the way, didn't work out for different reasons. And then slowly but steadily, it became what it is today, which is more than $1 billion project, which is global. A lot of it, the core of it, is in Greece, of which the core are the 3 hospitals. And then during COVID, which, as I keep saying, if there's one thing that came out of it, which was good, was that the stigma on mental health disappeared. I think everybody experienced some form of mental health issues, family, community, and it became easier to talk about it. And now we take it for granted, but before COVID, it wasn't easy to talk about mental health in the way that we talk about it today. So we integrated the mental health part into a global health initiative, which we'll see in the next panel. But the first panel, let's invite, please, our guests. So we have, as you see, Emile Bacha, Mayse, Nababteh, Miquel, Pons, Jeffrey Kahn, Themistokleous, Kathryn Scott, and then I'll talk about Andrew, who couldn't be here with us, and Renzo Piano. So thank you. So thank you all for being with us. It really means a lot to us that you could all be here. And basically, again, because we don't have so much time, the idea was to basically talk about the collaborations and talk about what it means to be working together from different areas, from different specialties, and from different parts of the world. I also wanted before to say that actually Dr. Kahn, who was here earlier this week, but he had to leave earlier. He couldn't be here, but we're very happy about the collaboration on pediatric cancer, and they've been helping us also with the hospital in Thessaloniki. If Iliana, if you want to say just a couple of things about Dr. Kahn and the Memorial Sloan Kettering.
Yeah, our collaboration with Memorial Sloan Kettering, it's actually an idea that came from you, Andreas. And for the last 2 years, we've been working tirelessly on it. And today, it has morphed to a global pediatric cancer program led by MSK and including a lot of the partners we see here today. There have been MOUs signed with the King Hussein Cancer Foundation and Center, with SJD, Barcelona Children's Hospital, and of course with the Greek state in order to connect it with the University Pediatric Hospital of Thessaloniki. The goal of it is to bring excellence in this highly sensitive area of care and bring different partners that have a lot that we can learn from and a lot that they can learn from us as well.
Thank you. And before we go into the discussion, a few words about Renzo Piano. And as you know, Renzo is the architect of this whole project here, of the SNFCC. And when we called him, almost 8 years ago, and he picked up the phone, and we said, we have another project. So he just said, what now? And we said, hospitals, whatever. And within like a few minutes, he came back, he said, I'm in. So we're very appreciative of the relationship we have with Renzo Piano. As I keep saying, He's a friend, but he's also a great human being. And he's one, with my limited experience, he's one of the few great architects who doesn't care about his own legacy in terms of, I'm going to do this so people can learn the new thing, how you make buildings. He makes everything always focusing on the end user. He cares about how they're going to be functional, how are they going to be beautiful for the end user. And he did the same here. He couldn't be here with us, but he has sent us a small video, which we can watch now.
Hi, my friend. This is Renzo Piano. I'm sorry not to be with you. I don't even have a very good excuse. It's a family commitment, but for me, the Niarchos Foundation is a family. We have been working together for 20 years. The Niarchos Foundation is today 30 years old, and out of those 30 years, 20 were spent together. And we have done so many things. We have done the Niarchos Foundation in Athens. We have been working in Agora at the Johns Hopkins University, helping on the Uganda hospital, and now working on the hospital, the 3 hospitals in Greece. That's a great, important thing. And time is now to add humanity and beauty, the real colors to the hospital. So it's a long story. And you know why? Because we have the same desire. You and us and me all together, we believe in making a better world. That's all, better world. And that's the reason why we are so happy to work together. We are very good. And I have to say something about my friend, Andreas. Andreas was, we became friends from the first moment we met in New York at lunch. And then we have been understanding each other. And this was very simply for one reason, that there is affinity. Affinity is a very nice thing. You have life, parallel, but then suddenly they meet. And this is where the miracle happens. So Andreas, I love you, and I love all of you. So, sorry again not to be with you, but have a very good time there. Bye-bye.
So the 3 hospitals, as I said before, are at the core of our global health initiative. And all of you, directly or indirectly, have helped us make this project. And they're going to be delivered, hopefully, next year, in 2027. And maybe I'd like to ask each one of you to tell us a bit about your own organization and how this partnership, how do you assess it? How do you see it, what you offer, and also what maybe you are learning from that relationship? So up to you guys to start. Who starts? Emile.
So thank you very much, and thank you for having us here. Well, I'm going to say that initially when I was contacted by SNF, I was dubious because I'm a pediatric heart surgeon. I was like, why do they need to talk to me? And what is this all about? And sometimes organizations want to dabble in pediatric heart surgery because it's sort of sexy, quote unquote. And, but then quickly I realized that this was actually a very well thought through project, and that the northern part of Greece is underserved in terms of children with heart conditions, which is much more frequent than people realize, and that the countries north of Greece also are underserved. So it became a very, very worthwhile project, and we have been very happy to collaborate. So I don't think I mentioned I'm at Columbia University, New York Presbyterian Hospital in New York City. And so it's been a great pleasure, and I think we're going to be doing great things for the children of Greece and of the region, and maybe even beyond.
If I can ask you, is there anything which has surprised you hopefully on the positive side from this experience, from your visits? What would you say that has actually stuck with you?
Several things. First, I was pleasantly surprised, first of all, by the level of preparation that has come from SNF staff, Eliana and Panos and everybody else. Also, the support we have received by the Greek state in the form of Marios Themistokleous has been really amazing. I've been in other countries. This has been really special, what we have been able to receive. And finally, when I see the hospital, the planning of the hospital and how it's being, the design of the hospital, I get jealous a little bit because I wish I had some of these designs in my own hospital in New York.
You can always move here if you want.
Yeah.
Trying.
Talk to my wife and then we'll... But yes, so I do, it's very impressive and it's a chance because you're doing it fresh, new. And so you get to do it right from the first time, so it's wonderful.
Thank you. And before Mr. Themistokleous speaks, I do want to highlight that, again, we talked about partnerships, and sometimes people say about the great partnership, and it stays there. Of course, as I say, the proof is in the pudding. I mean, how does it actually work? And I have to say thank you to the Greek government and all the Greek governments. I mean, we've had an amazing relationship with different governments, politically different, you know, coming from different beliefs. But I think everybody recognizes that the work is for the good of the Greek society. So all Greek governments we have been very good partners with. But especially, you know, as they say, behind every institution, behind every organization, it's the people. And Marios Themistokleous, I think the Greek state is very lucky to have him, and we are very lucky to have him as a partner, because it's been a real partnership, day in, day out. And so that part, I think we're very lucky, both sides. And we hope it continues with whichever government, if it's the same government or different government. After deliveries, it's important for this partnership to continue for the good of the people. So, Maria, if you want to say a few words, thank you.
Hi, good morning. Thanks for your good words. My name is Marios Themistokleous. It's already written there. And my whole career, my whole professional career is closely connected with the Stavros Niarchos Foundation and the initiative. I started 7 years ago, actually from this project, acting as a coordinator between the public domain and the SNF Foundation. And my duties, my work is to make sure that it will be a smooth implementation of the whole initiative to overcome obstacles. And this is something that is in my daily routine. Now, every Monday, we are starting with a call, with a Zoom, with Panos and Eliana. And I'm very proud working on this project. It's well beyond infrastructure. It's the 3 hospitals you already mentioned. It's the helicopters, the planes in the emergency service. But it's all these projects for education, for trauma, for the infection, disease and control, for the mental health. And this is something that enhances the transformation of the national health system. It helps us getting better. It helps transform the whole system. It's leading where we should go as a whole system. And I'm in this panel, which we are going to discuss about the international collaboration. I will mention about the new pediatric hospital in Thessaloniki that will act as a natural hub for international collaboration. We have here Professor Bacha. You are more than welcome to come and work in Thessaloniki. We can change the law for you. We can change the reimbursement of what we are giving to doctors.
Thank you.
This is an official statement. And we have a very close collaboration with Dr. Bacha about establishing a pediatric heart surgeon in Thessaloniki, with Barcelona Hospital, with Sloan Catering, with Johns Hopkins about bioethics. We are very proud about this. We are going to learn from this collaboration. I think that probably you should learn, or you should get something for us as well. You are in the country of Hippocrates. It's what we are discussing before. And once again, personally, thanks, Andrea, for this opportunity. It's an amazing project. It's a huge project, and you have to be very proud about this.
We are. Thank you. Thank you. And again, it's all these partnerships that at the end of the day, everybody benefits. And it's not just in theory. Everybody benefits from good partnerships. So thank you. Kathryn, hi. Thank you for being here. Would you like us, people would say, why Yorkshire? You know, how come you're here? But we can leave that aside. What about your experience working with RMP and the fellowship exchange, and maybe a few words on physical exercise, you know, in cancer?
It is an honor to be here today, and thank you so much for the invitation. This partnership started in a bit of an unusual place for us. You may remember it started with a football shirt, a raffle, and a conversation. And that conversation led to such a magnitude of change for physical exercise for cancer patients. Because we already know it works. We already know people live longer if they exercise after a diagnosis of cancer. We know it improves recovery. And we know it improves and reduces the risk of a cancer coming back so much, often 66% reduction in a cancer coming back. But it's not in standard care. So the partnership was really important for us because it allowed us to give that a voice. So we've been working, we're a charity that's 101 years old because Yorkshire is a region that unfortunately has 7 million people in it, but unfortunately there's quite a lot of late diagnosis and poor outcomes in cancer. So we took a really big step and decided not to just do research, but actually to deploy it through this partnership. And the partnership, it began in a really practical way. We were scouring the world looking for expertise in cancer exercise. And you found us and introduced us to the SNF. And then the partnership with Regeneration and Progress started. And that was a real moment for the charity. We'd started really small in one centre, and as a result of the confidence that we got from the partnership, we expanded. We're now at 9 sites, and we've treated over 4,000 cancer patients across Yorkshire. But I do just want to take the opportunity to say something to the audience about exercise and cancer. It really does improve survival. It really does support recovery. It's not routinely offered. If this was a drug, it would be a blockbuster drug, and it would be prescribed as part of every cancer patient's journey. And that's the journey we're on. We want to make sure that the world knows about this, and the partnership gives us a great platform to do that.
Thank you. Thank you very much. Thank you. Mayse, hi, thank you for being here.
Good morning.
Thank you for all the amazing work you do at the hospital. So I think it would be interesting if you tell us a few words of what you do in Jordan and then of our collaboration.
First of all, good morning. Thank you for inviting us on this important panel and on this important stage. I think it's, for me, I think it's impossible to talk about the mission of the King Hussein Cancer Foundation and Center without talking about, you know, the story, the human story behind it, and our hero, which is the late King Hussein. You know, he spoke openly about his disease at a time when nobody spoke about it. There was no cancer facilities. People were dying of cancer, and he broke a huge taboo at the time. And it was really a Jordanian dream, really, that every Jordanian would have access to the same treatment that he had. This dream really transformed into a singular mission that every person should have the same access to treatment regardless of their background. And under the leadership of our chairperson, Her Highness Princess Ghida Talal, who is with us today, this cancer center really, against all odds, has transformed into a regional and internationally accredited, well-renowned regional center that's quite unique where we come from. Until today, we celebrate our 25-year anniversary this year, and we have treated over 75,000 patients. 35,000 of them are active patients. We have reached cure rates among pediatric that goes up to 85%. We're the biggest healthcare employer, actually, in the country. Not to mention, all our work in strengthening health systems as well. But I think what's unique about our story is that we did not stop there. We went across Jordan and across its borders, and everybody knows where we live and the uniqueness of where we live. And people see Jordan as a safe haven in the middle of humanitarian crises, refugee displacement, lack of access to medications, let alone cancer care. Children who should be going to school and playing are fighting for their lives, looking for access for treatment. And the truth is, and we say this in every meeting, is that we could have made a choice that this is not our business, that we don't have the facilities or the capability to do that. But that's not the decision that we made. What our leadership decision was that child first, dignity first, refugee first, displaced first, and if anything, this is a reflection of what Jordan is. We treat everybody, especially displaced and refugees, as guests, and it's a reflection of what we believe, that health is and health equity is a human right, and it's not a luxury or something that an extra thing that we give. And since then, the Cancer Center has become a regional hub where 30% of our patients are non-Jordanian, mainly displaced and refugees are the 30%. And through our Goodwill funds, we were able to cover over 6,000 underprivileged cancer patients and displaced for over $200 million. I mean, we are an organization at the end of the day. We are not a country. And this is, I think, where our partnership with SNF really came through, is that we champion the same values. And we talk a lot about partnerships, and I think this is really important. It's not about charity or finances, because it's not about the money only. It's about shared values. It's about, being genuine in partnership. It's about being practical. It's about believing in the same thing, which is human dignity. And that's where, our grant and our partnership together, we were able to save over 176 children, displaced children. And I do want to mention that this is not enough. It's not enough to give access to care. What we should be giving is access to quality care. Because what's the point, again, of giving access and then them not surviving or not living a quality life? And I think, I remember this Syrian patient. He stood in front of our facility, and he was a refugee, and he said, "Why would they accept me?" And we answered him, and we said, "Actually, we are established before you." Because he was so used to subservice. And this is where I think our partnership also with Memorial Sloan, you were able to give us access to this partnership. It's been amazing. We've signed a memorandum of understanding. We are on their global tumor boards. We have fellows going now to their facilities. It's about research. It's about quality. It's about CAR T-cell, you name it. So I think this is the essence, is that our humanitarian mission is not just talk, but it's important to make sure that we advocate for everybody, that we talk about the displaced and those who are in need in every speech, in every panel, in everything that we talk about, to make sure that we have, we are the voices of those who really need us.
Thank you. And as you said, everybody talks about access and quality. And I think you're very close to being perfect in both, so really well done. And thank you for the partnership, thank you for the collaboration. Miquel, Pons, you're a newcomer to the Barcelona Children's Hospital. That's another relationship that actually started from football years ago. We're very honored and very happy for the collaboration. If you would like to tell us a few things about the hospital and about the collaboration.
Yes, good morning, thank you. It's a pleasure to be here. Really, we start our relationship with Leo Messi and with Bacha Foundation because in this moment Leo Messi was playing in Barcelona. And we were building the new cancer center, the Pediatric Cancer Center Barcelona, and Leo Messi was the main ambassador of the fundraising campaign. Fundación Barça put in contact with SNF, you analyze and you knew the project and you decide to support it and then start our relationship. An interesting partnership because in the first moment we shared the same goal to get the best building, the best organization in order to provide the best services for cancer center. Our hospital is the largest hospital, pediatric hospital in Spain, and one of the largest in Europe. And our main value is the hospitality. So we try to get the best balance between humanism and science. And I think we shared this objective. So work day after day. We put the families and patients in the center. We try to do patient-centered care. And so the families are one of the main actors in the design and to organize our center. So it's a nice experience to work with families, and it's a very nice experience to work with SNF as a partnership in order to provide these new infrastructures. Now we are working in rare diseases with other projects that you are supporting also, and we are performing a program beyond the walls of the hospital, working under the idea of liquid hospital in order to provide services at home and in other countries, and in order to expand our project, our model to other cities and countries in South America and also in other parts of Europe. So thanks for your help and for your support in our project.
Thank you. Thank you. So, Jeffrey, ethics, do we need them?
Now more than ever. Kalimera, good morning. Thank you, Andreas, for your long-standing partnership. And maybe just to say, our partnership at Johns Hopkins and in the Berman Institute predates the Global Health Initiative. Of course, as you can all see, I'm the Andreas C. Dracopoulos, director of the Johns Hopkins Berman Institute of Bioethics. So we have a long-standing relationship. The partnership on the Global Health Initiative was born over a lunch, I think, that you and Effie Viana, my colleague at the ETH in Zurich, had with you maybe 7-8 years ago at this point, where you asked us a question about whether there was bioethics education and scholarship happening here in Greece. And we weren't sure about that. Effie, my colleague, is actually from Lefkada, so she's Greek, but she works in Zurich. And we, at your urging, offered one workshop that we thought might attract 50 applicants, and it attracted 100 people. We chose half. The next year, we thought, well, there's another 50 people at least who will be interested. We had 250 applications for 50 slots, and it has grown sort of exponentially since then. We're now at almost 600 alumni who have gone through our programs, and from that one workshop over a summer, we're now offering 6 programs per year. And so we are working very hard to build capacity and a network and critical mass of people who are doing bioethics here in Greece. The next step, as the minister mentioned, is for us to work with the Global Health Initiative and the hospitals and the ministry to build best-in-class, world's best ethics, content capacity, consultation, training in first the hospital in Thessaloniki, the pediatric hospital, and hopefully then expand from there. So just to say one last thing, the slogan of the conference is humanity at the core. What is humanity without ethics? Ethics is foundational to humanity, and ethics is foundational to patient-centered care, to the best quality care that reflects the values of the patients and their families. And so we're thrilled with your partnership and your support, and we look forward to continuing to make humanity be the core. So thank you.
Thank you. Thank you. So as we said before, the hospitals are the main core of our global health initiative, and that's been maybe the excuse that we have all gotten together with ideas to work thinking about the hospitals. So can we watch a few minutes a video on the 3 new hospitals, please?
Η υγεία είναι βασικό και αναγκαίο αγαθό για κάθε πολίτη και είμαστε τυχεροί και περήφανοι που βρισκόμαστε στη θέση που είμαστε, να μπορούμε να συνεχίσουμε να προσφέρουμε για μια καλύτερη και πιο αποτελεσματική δημόσια υγεία, μια πιο ανθρώπινη κοινωνία.
Οι δωρεές αυτές όλες από τα κτίρια, από τα ελικόπτερα, από τα αεροπλάνα, από τα εκπαιδευτικά προγράμματα σηματοδοτούν πού θα πρέπει το Εθνικό Σύστημα Υγείας, πού θα πρέπει και τα υπόλοιπα νοσοκομεία να φτάσουν.
Making an hospital is one of the most important things in life for a life, because it's where medical science meets humanity.
Θέλω να εκφράσω διαρκή ευγνωμοσύνη και ευχαριστίες για αυτή τη μεγάλη δωρεά, για αυτό το μεγαλεπίβολο έργο που μας χαρίζεται και που αλλάζει τον ιατρικό χάρτη της περιοχής μας, της πολυπολιτισμικής, που αλλάζει βελτιώνοντας την ίδια μας τη ζωή.
Όταν δεν υπάρχουν κρυφές ατζέντες, όταν υπάρχει διαφάνεια, όταν υπάρχει σκληρή δουλειά, τα πάντα γίνονται.
Ότι το νοσοκομείο δεν είναι ένα ψυχρό κτίριο το οποίο ακουμπάμε την ιατρική μας περίθαλψη. Είναι ένα σημείο αναφοράς, είναι ένα σημείο το οποίο πρέπει να δεθεί με την κοινωνία και ακριβώς αυτό το χαρακτήρα δίνεται.
Βρισκόμαστε στο χώρο στο οποίο θα ανεγερθεί το νέο νοσοκομείο της Σπάρτης. Πρόκειται για ένα πρωτοποριακό έργο για τον νομό Λακωνίας αλλά και για την ευρύτερη περιοχή της νοτιοανατολικής Πελοποννήσου που θα αναβαθμίσει τις συνθήκες νοσηλείας των πολιτών σε ένα, θα έλεγα, πρότυπο νοσηλείας.
This is a beautiful place for an hospital, especially as a pediatric hospital, because you can see this is a perfect location.
Η δημιουργία του νέου παιδιατρικού πανεπιστημιακού νοσοκομείου στην πόλη μας, στη Θεσσαλονίκη, θεωρώ ότι αποτελεί ένα έργο πνοής, όχι μόνο για τη Θεσσαλονίκη, αλλά και για όλη την Βόρεια Ελλάδα.
I'm myself Italian, and we are being fed by the same sea, Mediterranean Sea. So we are unified by this culture, that is humanism. And in an hospital, those things come together. Science, precision, medical precision, and human. And you know, one thing very important is affection and passion. You know, without that, it's very difficult. And I'm so pleased because today I can feel this.
Τα έργα αυτά δεν ανήκουν σε καμία κυβέρνηση, δεν ανήκουν βεβαίως και σε εμάς, ανήκουν στον κόσμο, ανήκουν σε εσάς.
So we have a few more minutes, and just to open it up, if anybody has any thoughts, anything to discuss, maybe Eliana, you can start between the intra-collaborations and what, from our perspective.
I think what is important to say, Andreas, we heard in the video, and this is something that you always say, these are hospitals for the people. We have international partners, we discuss every day, and they helped us learn so much. We work closely with the Greek state in a close partnership model to define the clinical pathways on staffing, etc. Something that you saw in this video is again an idea that has come from you, Andreas, through the town hall meetings. And this is a very nice story, actually. We hold regular discussions in the 3 locations of the hospitals, in Komotini, in Thessaloniki, in Sparta. I had the honor and the privilege to participate in some of these discussions. And the idea to incorporate something as complex as pediatric cardiac surgery came from a family. It came from a family that was struggling with congenital heart disease, and they had to go through the whole ordeal of seeking care in Athens and oftentimes abroad. We took this seriously, we took it back. We discussed with our health consultants, Dr. Roussos, Dr. Koulouvaris. We reached out to you, Dr. Bacha. As we said, you were not convinced in the beginning. It took a lot of hard work. It took a lot of visits. And today we're in a good position to say that we can see this happening. Something else is that these partnerships don't come in a vacuum. We have been traveling to Jordan. We have been traveling to Spain, to Yorkshire. I want to say something on SJD. We had the hospital tours earlier this week in northern Greece on Monday and in Sparta on Wednesday. Gloria from SJD was with us at the Thessaloniki visit. We've been to Barcelona 7 times. We've been there 7 times to see what it actually means to put patients at the center. This is not a catchphrase. This is something that requires very careful and very sensitive planning, especially when we're talking about children. We had the Renzo Piano team with us. At the time, the design was almost closing, and you were so generous to have us there for a week with the entire design team, and we saw every single bit of the hospital. We were in an inpatient room, and in our design, to be very frank, we had the bed, the inpatient bed for the children. It's all single and double rooms, which is a big innovation in Greece. But we had a pull-out chair for the parent to stay by. And you said to us, it's important you have beds. It's important that the child feels safe. They need to have their parents close to them. The design was just finishing. We had to go to tender shortly. We went back. Renzo Piano never changes his design. He did it in this case. And it was such a moving moment when Panos and the team and all of us were able to show you through the mock-up space we had prepared the pull-down beds that are in every room of the Thessaloniki hospital, including in ICU areas. So this was just some example of what it takes and the discussions we've been having with you, Jeff, with Mario, with Professor Vagena. I know that the president of the School of Medicine of the Aristotle University of Thessaloniki was here in Nostos yesterday. Nostos is a place of gathering as well. You were discussing very concretely for the next training in November. Kathryn, Thessaloniki Hospital will have a place for physical exercise and rehabilitation. We hope to learn so much from your collaboration with RNP and bring it to Thessaloniki, and through the MSK partnership that includes the King Hussein Cancer Center. We also went to bring these lessons home also.
Thank you, Eliana. And also to take this opportunity to say thank you to Eliana and Panos and our whole team. I don't know how, but we have become experts thanks to Eliana and Panos and our team. And sometimes I get upset by how much they work and how much deep they get into all details. And I said, we are not medical specialists, but we become. And that's part of the whole process of a good partnerships. Everybody learns and everybody goes deeper, and the commitment is there. So thank you too. And thank you for bringing up the issue about the communities, because again, with all the partnerships, that was an important partnership with the local communities, because at the end of the day, that's where the hospitals are going to be, and it affects them mainly in a positive way, but there are also things that we have to take into account, which we have, and it's been a process, an evolving process. So again, the word partnership sounds easy, but to be implemented needs a lot of work, ongoing work, commitment from all sides. But at the end, everybody benefits, so that's great. So thank you all. Sorry we don't have more time to go into more details, but it's an honor to have you here. And thank you again for all this ongoing collaboration. Thank you.
Καλημέρα.
Είμαι η Μαριλένα.
Και εγώ είμαι ο Έας.
Και πάμε μαζί σε ένα ταξίδι στη Βόρεια Ελλάδα με το Ίδρυμα Σταύρος Νιάρχος.
Μόλις φτάσαμε στην Αλεξανδρούπολη.
Εγώ θα πάω στο υποκατασκευή Γενικό Νοσοκομείο Komotini, Ίδρυμα Σταύρος Νιάρχος.
Εγώ θα πάω να δω όσα κάνουν οι κινητές ιατρικές μονάδες που σήμερα βρίσκονται στα απομακρυσμένα απομακροχώρια Ροδόπης. Μια πρωτοβουλία του Ιδρύματος Σταύρος Νιάρχος που υλοποιείται από την ΑΜΚΕ Αναγέννηση και Πρόοδος. Το πρόγραμμα αποσκοπεί στην πρόληψη ασθενειών, στην αναβάθμιση της ποιότητας ζωής των ανθρώπων και στη μείωση έκτακτων ιατρικών περιστατικών.
Είμαστε καθοδόν για Komotini.
Πάμε λοιπόν να ξεκινήσουμε τα tour.
Το κτίριο του νοσοκομείου θα περιβάλλεται από μια πυκνή δασόδη περιοχή με 1.200 δέντρα και θεραπευτικούς κήπους που θα είναι προσβάσιμοι στο προσωπικό, στους ασθενείς και στις οικογένειές τους. Ο Renzo Piano, αρχιτέκτονας Γενικού Νοσοκομείου Komotini, Ίδρυμα Σταύρος Νιάρχος, βλέπει ένα νοσοκομείο ανοιχτό και προσβάσιμο σε όλους τους κατοίκους της πολυπολιτισμικής κοινωνίας της Komotini.
Στο Φίλιρο Θεσσαλονίκης παίρνει μορφή ένα έργο ορόσημο για τη δημόσια υγεία, το πρώτο αποκλειστικά παιδιατρικό νοσοκομείο της Ελλάδας εκτός Αθηνών. Δωρεά του Ιδρύματος Σταύρος Νιάρχος και σχεδιασμένο από τον Renzo Piano, θα προσφέρει τριτοβάθμια παιδιατρική φροντίδα σε όλη τη Βόρεια Ελλάδα, λειτουργώντας παράλληλα ως κόμβος εκπαίδευσης και έρευνας σε συνεργασία με το Αριστοτέλειο Πανεπιστήμιο.
Καλημέρα, είμαι ο Έας. Είναι 7 η ώρα το πρωί και φεύγουμε με λεωφορείο να επισκεφτούμε τη Σπάρτη.
Πάμε με την ομάδα της Διεθνούς Πρωτοβουλίας για την Υγεία.
Στη Σπάρτη παίρνει μορφή ένα έργο ορόσημο για τη δημόσια υγεία στην Πελοπόννησο. Το νέο Γενικό Νοσοκομείο Σπάρτης, δωρεά του Ιδρύματος Σταύρος Νιάρχος και σχεδιασμένο από τον Renzo Piano. Θα καλύπτει ένα ευρύ φάσμα ειδικοτήτων από καρδιολογία και χειρουργικές μονάδες μέχρι εντατική θεραπεία, ενώ θα περιλαμβάνει και αυτοτελή μονάδα ψυχικής υγείας ενηλίκων. Με παράδοση εντός του 2027, ενισχύει συνολικά το δίκτυο υγείας σε ολόκληρη την Πελοπόννησο.
Τα day trips του SNF Nostos 2026 μας έφεραν πιο κοντά σε ανθρώπους, έργα και πρωτοβουλίες που διαμορφώνουν το αύριο. Κάπου εδώ το ταξίδι μας ολοκληρώνεται.
This was a TikTok video which we took this week when some of you went to the two trips, both in northern Greece, Komotini and Thessaloniki, and also in Sparta. So we took that so we can remember and have the good memories. So thank you all for going. I know it was, especially the one to northern Greece, was a long day. Who went there? And can you raise your hands? Whoever went there? It was a long day, but I hope you enjoyed it.